Congress should abide by the same oath that doctors take, to do no harm. Years of promising to repeal the Affordable Care Act is not an excuse for doing harm to the American healthcare system and eroding the important patient protections that cancer survivors depend on.
On behalf of the more than 1 million patients the Lymphoma Research Foundation exists to serve, we ask that you vote against the current repeal measure and work together to ensure that every cancer patient has access to quality and affordable health care insurance.
ASTRA represents physicians who treat 1 million cancer patients a year. They're very concerned that those patients will be subjected to new pre-existing condition limitations. In addition, recent studies have shown that the Medicaid and private insurance expansion under the ACA have reduced cancer patient deaths. We urge the Senate to vote no and protect vulnerable cancer patients.
CancerCare urges the Senate to reject the Graham-Cassidy bill because it would prevent cancer patients and survivors from access to affordable treatment and medications.
The Oncology Nursing Society, representing 40,000 oncology nurses, urges a no vote on any legislation that limits access to cancer care for all Americans and denies coverage for pre-existing conditions.
The cancer support community advocates for high-quality, comprehensive, and affordable health care for all people, which is why we oppose the Graham-Cassidy repeal bill.
The Association of Oncology Social Work represents social workers who know that loss of health care impacts patients, their families, and communities. We urge the Senate to vote no on the Graham-Cassidy repeal bill and work together to improve health care for all.
On behalf of the million-plus colorectal cancer patients and survivors Colon Cancer Alliance serves, we urge the Senate to vote no on the latest repeal bill and work together to improve access to health insurance.
Living Beyond Breast Cancer serves people impacted by breast cancer. All of them rely on access to affordable, quality health insurance. We urge the Senate to vote no on the Graham-Cassidy repeal bill.
On behalf of the million patients living with melanoma, the Melanoma Research Foundation urges the Senate to vote no on the Graham-Cassidy repeal bill.
Fight Colorectal Cancer represents over 1 million colorectal cancer patients, caregivers, and survivors. We're asking the Senate to vote no against the latest repeal bill. We're asking you to work together to increase access to healthcare insurance.
This bill would allow insurers to charge cancer survivors and those with other pre-existing conditions higher rates. We can't afford to go back to the days when Americans were penalized for getting sick. On behalf of FORCE and the millions of Americans affected by hereditary cancer, we urge you to vote no on the Graham-Cassidy bill.
Half of the 70,000 adolescents and young adults diagnosed with cancer each year in the United States. We urge the Senate to vote no on yet another repeal bill and protect access to quality health care.
The Cancer Legal Resource Center opposes the Graham-Cassidy repeal bill because navigating insurance is hard enough without having to worry about being discriminated against for having a pre-existing condition.
Triage Cancer serves cancer patients and survivors around the country who rely on access to quality, affordable health care. On their behalf, we urge the Senate to vote no on the Graham-Cassidy ACA repeal bill.
PCa Blue serves prostate cancer patients and survivors who rely on access to quality, affordable health insurance. That's why we urge the Senate to vote no on the Graham-Cassidy bill.